What is the deal that PCOS is no longer PCOS?
Find out today on Medical History Mysteries.
Hey, everybody, welcome back to Medical History Mysteries. I'm Pam Maragliano. With me, as always, Tom Viola. Tom, what is happening? PCOS, no longer PCOS.
I just was able to finally say PCOS, and now I have to change it again. No, I'm just kidding. So polycystic ovarian syndrome has been around as a term we've used, I don't know, probably close to 40 or 50 years. It's been a long time. And now they've made a change because the feeling is that PCOS, PCOS, really didn't describe the syndrome as accurately as the new name, which I'm going to have to read it because even I have trouble saying it. So it's polyendocrine metabolic ovarian syndrome, PMOS. Okay, polyendocrine metabolic ovarian syndrome, and it was always, thought to be something that was relatively easy to diagnose. Obviously, from multiple cysts on your ovaries, hirsutism, facial hair, places where you didn't want to have hair. Um, but this new name gives it a broader scope because the PCOS name sort of gave it this, oh, it's just associated with my ovaries. But then we found out that men can get this as well, and obviously men don't have ovaries, so that's why I think even though it still has ovarian in the title, I know, I think it's more descriptive now that it can be a syndrome that can affect both men and women.
So, what happens to a man if he has this?
So men get this, and when you if you Google it, right? Can men get PEMOS? They say yes because they have a male equivalent, and the male equivalent is basically a metabolic disorder or hormonal disorder. So they have problems with growing a full beard, right? Like they can't grow full facial hair. Now that could be due to a lot of reasons, but that's one of them. Early onset male pattern baldness, right? So that's another issue. Elevated androgen levels, which could be good in men, but not so good, depending on, the fact that it can increase their risk of certain cancers. But the big thing is an increased risk of insulin resistance, and that can lead to type 2 diabetes. And that can also, as you know, there's a link between cardiovascular disease and diabetes. So that just increases the risk of metabolic syndrome. And so, since men don't have ovaries, we don't consider it as a thing that men might have. We might overlook it altogether, and that can affect the treatment. Now, I will tell you, historically, the treatment has always been a drug like metformin because one of the issues with PCOS is hyperinsulinemia, an overproduction of insulin. But that may not be in every case. So that's sort of been pushed to the side as a diagnostic tool. And there's other tests they can do, well, basically hormonal tests they can do to figure out if that's indeed the case. But not trying to take anything from women who end up getting this. It's just because I think the name change really brought around new awareness about what this condition is and who it can affect.
So, this is interesting. This happens a lot. I don't know if you've heard this, but especially if we wear loops. We obviously perform a head and neck exam and we get to see pretty well what's going on somebody's face.
Yeah,
And we can identify if a woman has significant facial hair. I mean, sometimes you could see it with the naked eye, but you can also see it with your magnification.
yeah.
So I don't know if we would be as in tune to whether, if a man isn't growing a full beard or something like that. But as a dental professional, what should we be looking for? And how do we suggest to the patient that they maybe have a conversation with their physician?
So that's the thing, let's play this out, right? You're a woman and you have facial hair and you don't want to have facial hair. Well, what do? You go to a place that does cosmetic hair removal, you get laser done, you get waxing done, whatever. And so now one of the easiest diagnostic tools, if you want to call it that, we would use is gone because they've had their facial hair removed. So you don't even know that they might have PMOS when they do. And this is a woman, let's say in her, early 30s, maybe late 30s, early 40s, who ends up with diabetes type 2 from insulin resistance, cardiovascular disease, things you ordinarily see until later in life. and they don't have the characteristic metabolic syndrome physiology. You know, that their body shape doesn't suggest they have metabolic syndrome. So what's going on here? And if they don't see their doctor on a regular basis, and a lot of people don't because things are expensive these days, and a lot of people have lost their medical insurance or can't afford medical insurance, but they do want their teeth to look nice. So they come see us. And our advice is, well, go see your doctor. Well, maybe they don't have a doctor or they don't go see a doctor. So sometimes it's us. And so we're always on the lookout for anomalies, like a woman in her early 30s, late 30s, a man early 30s, late 30s, who develops metabolic syndrome, who develops type 2 diabetes, hypertension. These are things that are maybe they don't even know they have it, right? So I can walk around with a blood pressure of 180 over 100 and nobody would even know because I don't, maybe I'm a little diaphoretic, I'm a little sweaty, but you wouldn't know, right? And maybe I'm a woman and I've got insulin resistance and I'm losing weight, which in a way is, hey, that's great, you know, but honestly, that's not good because of the reason for the weight loss. So sometimes it's us as the last line of defense because we see things that maybe the patient doesn't see. And this thing doesn't lie, okay? So we all know what signs to look for if a patient has hyperglycemia, you know, and maybe we encourage them to get their A1C checked, right? Male or female. And we all know that the potential for cardiovascular disease. And so taking blood pressures and pulses it should be our standard. I know a lot of us don't do it. But as I've said 1,000 times, I know you've heard me say it, without a baseline blood pressure for patients, right? If you take their blood pressure every time you see them and you get a baseline, and today they come in and their blood pressure is elevated, well, why is that? Today's not a good day. Let's figure out what's going on. Okay, but if you didn't have that baseline, you wouldn't know. So now that's a walking medical emergency. So I think that this is the reason why this is important because so many women I know who had PCOS didn't know they had it. And it turned out that an eagle-eyed dental professional or some other professional pointed it out to them, and they were able to do research and find out. So now that PMOS and it can apply to men and women. It's something that we can be involved in.
I just feel so strongly that continuity of care is so important and creating relationships with your patients and always being vigilant for changes. Like you're saying, like we know our patients, we get to see, you know, you might not think that they have more hair, but if you've been seeing them for the past X number of years, this is maybe a change that might come up in conversation, or it might be something that you notice that they've noticed as well. And then we can maybe suggest that they go and see their physician and get this checked out. So it might, like you're saying, be something initially cosmetic that might bother the patient and may not even ever come up in conversation. But I think this was a great way to increase awareness and hopefully help our patients get the care that we need. And I think, again, gosh, especially dental hygienists, there's just such an amazing opportunity
Yeah.
to get people healthy and improve lives. And I hope that anybody that's listening to us today just knows that you're making lives better by showing up and going to work each day. And so for some of us it's a job, some of us it's a calling, but we
Yeah.
really do positively impact our communities. So I don't know. Bravo to all of us out there that are doing it, but also thank you so much for increasing awareness about this topic and teaching us a new name because I didn't know that either.
That's why I love dentistry, folks. I will tell anybody, whoever asks me, dental professionals save lives every day because they save people from themselves, right? You're the fresh set of eyes. And so, if you can make a difference in their life, then, I know you may never get the kudo, you may never get the pat on the back, hey, thank you. So that's why I make sure I spread the message to thank dental professionals for what they do, because maybe they don't get the thank you, but it's one you truly deserve.
Ugh, I love that. All right, everybody. Thank you so much for joining us. I hope you feel our little virtual hugs out there, and I hope you enjoy your day and join us next week for Medical
Thanks.
History Mysteries. We'll see you then.
See you then.